As we enter the reopening phase in the U.S. here and in our economy, and various states are in the process of reopening fully or partially, some are still closed. Getting information on how other countries have handled this is really substantial input for us in determining how things could possibly go here. So the first chart that we're going to look at is the cases by country, and the countries that we're looking at in general, and the detail relative to how each country has handled their response to the coronavirus. So let's first look at the case counts.
And selecting these countries, they're selected because they've taken very unique approaches to counteracting the virus. And one thing before you look at the case counts is just to level set, this is cases per million people, and these are very different populations. So Iceland, for example, only has 360,000 people in the country. So you're actually scaling up. And then the United States is obviously the largest there. So Iceland, you can see a pretty rapid rise in cases and then flattening the curve quite aggressively. Sweden, still dealing with a linear increase in case counts. They've taken an approach basically, more sustainability, not imposing strict lockdowns. And New Zealand and South Korea, flattening their curve very early and taking very different approaches to do that. New Zealand being total lockdown, and then South Korea more being a very intelligent and informed and robust approach to contact tracing and testing. So very different approaches there and very, very different results.
And these countries have different political systems, obviously, and different levels of trust in their government and the responses. And they also have different levels of experience. So let's take a look first at South Korea, who back in, I believe, 2015 had a similar situation and learned a lot from their response to that. So walk us through how South Korea has handled their response.
South Korea has had probably the most robust approach to early testing and contact tracing. They had been ramping up testing prior to any type of an outbreak in cases. So they had diagnostic tests in place. They had an action plan as to where they were going to set up testing locations, and they already had contact tracing in place. And basically what that allowed them to do was, once they experienced a spike of cases, within about 15 days, they had totally flattened the curve because they identified patient 31, which was a woman who went to a mega church and basically sparked what is believed the rapid increases in cases they had. They were able to trace all of her contacts and all of those people's contacts and get them tested. They also have had robust antibody testing. So what they've been able to do is, you sacrifice some of your privacy, certainly, because all of your movements are being monitored, but they have not had to sacrifice mobility. So if you look at mobility data, which is tracked by, how much folks are moving around from their cell phones, the GPS trackers on their cell phones, they really haven't decreased their mobility at all. And they haven't had to impose extremely stringent lockdown because of how informed they've been in terms of contact tracing. They also have technology that allows you to know when you get alerted on your cell phone when you're going near a place where a confirmed case has been. So that they have definitely been the poster child for aggressive contact tracing and testing, and it allowed them to flatten the curve very quickly.
Yeah, and there's obviously those trade-offs are something that we debate here politically all the time. Maybe just perhaps explain in a little more detail the Government Policy Stringency Index that's listed here.
The Government Policy Stringency Index is an index created by Oxford Economics, Oxford University, where it measures the overall stringency on a scale from 0 to 100 of the government-imposed restrictions that have been put in place. So a low stringency index would reply, oh, we're just limiting groups of over 50 from gathering. That would not be very stringent. Versus 100 would be, you have to shelter in place. You can only leave your house for food. So that's the different scale. So it's a way to universally measure how strict each government's approach around the world has been to trying to control mobility.
Right. And then in terms of the striking factor on this page really is the change in GDP estimates between South Korea and the US, and maybe give perspective on why South Korea has not seen any significant deterioration in their GDP.
One of the big differences in GDP in the US versus elsewhere are just labor practices and labor laws. So in the US, we've had this huge deluge of unemployment, this record amount of unemployment. There are a lot more rules and factors involved in other countries around the world between when and how you can fire folks. So that's been one difference off the bat for all of these countries. But then also, if you think, if my movement is not actually limited, I can still go out. I can go to restaurants. All that happens is, if I start to feel ill, I can get access to a test and contact tracing. If my mobility isn't limited, then there really isn't a significant economic consequence of the government's strategy to control the virus. So you haven't seen a dramatic decrease in GDP, and we're not expected to see a dramatic decrease in GDP in South Korea.
So let's move on to New Zealand. Can you talk a little bit about how they addressed the virus response and what things we learned from them?
And New Zealand had a lot of things going for it. One, the population is only 5 million people. Two, it's an island, so it's very easy to restrict folks coming into the country. And additionally, basically what they did was they identified early on that they were not prepared from a healthcare perspective to deal with a significant outbreak in cases. And so they took the approach that we're not just going to try to flatten the curve, we are going to try to defeat the virus, meaning no new cases. And so they embarked on the strictest lockdown that we've seen. Their government policy Stringency Index for a month was nearly 100. Basically, you could only leave your house if you were going to get food or drugs. So a very strict lockdown for a period of a month, and they got to the point where they were reporting no new cases. So not a lot of testing going on, just really the draconian measures. But noticing, this is not a communist state, so it required a lot of faith and trust in government, especially because these lockdowns occurred before there was an outbreak of cases. At the time, it probably didn't even seem warranted, and all of your mobility was restricted. But now they're starting to come out on the other side of it and reporting zero new cases.
Right, and much less impact to GDP relative to what we're experiencing here. So let's compare and contrast that to some of the other countries who've had a little bit different experience. So let's first start with Iceland.
Iceland. So Iceland was very unique. Once again, you would expect a unique outcome because Iceland is a very small island. So we're talking about 360,000 people. But other things Iceland had going for it was there's an Icelandic company called Decode Genetics, which partnered with the Icelandic government and had been studying the genomes and sequencing of Icelandic people for over 20 years. And so what they decided to do was embark on one of the most aggressive testing programs in the world. And they were testing not only folks that thought they had symptoms, folks that weren't showing any symptoms. They were making that testing available before they even had confirmed cases. And they went beyond that, and they were randomly testing the population. So as a percentage of the total population, we're not talking about a big amount of people here, but as a percentage of the total population, Iceland has tested more than any other country. And they have been sequencing the genomes of every single confirmed case. So they've been able to identify more mutations than any other country of this virus. Once again, not different strains, but just mutations. So they could track, based on the genetic sequence of the virus of a confirmed case, where that virus likely came from. And you got a lot of very interesting statistics out of Iceland early on. One, you'll see their death rate is extremely low, 0.6%. So, in the US, it's more like 6% currently. And one, you have a smaller population, but the biggest reason is the denominator is so much larger. They've tested a larger portion of their population than anyone else. So they have a lot of confirmed cases. Their confirmed cases per million are very high. but their death rate is extremely low because they've made tests available to the entire population, symptoms or not. And because of this aggressive testing, basically what they've done is they haven't had to impose very many restrictions at all on the general population, but have imposed very harsh restrictions on the elderly and those that do test positive. And because of that, they haven't really had any increase in deaths or any stress on the healthcare system or had to impose any harsh lockdowns.
Let's take a look at Sweden before we summarize all of this.
Yeah, Sweden is basically the Swedish government took the approach early on that this COVID-19 situation is a marathon, it's not a sprint, and they didn't want to impose any restrictions on the economy that they thought couldn't be maintained for a period of 1, 2, 3 years, understanding the economic consequences and the health consequences. And so they put very lax restrictions on movement and on gatherings. Basically, you just had gatherings of over 50 people were restricted, and they asked folks to maintain social distancing. So on the spectrum of strict versus not strict, Sweden has been sort of the poster child of just operate as usual and see how this goes. And in terms of the economic data and the mobility data, initially Sweden was doing very well. But now they've started to see a pretty rapid increase in the number of case counts. And you'll also notice their death rate is elevated because they weren't as prepared in their healthcare system, not as prepared as others, and not taking as many steps to make sure older and at-risk folks are not exposed to the virus. So they're on the side of healthcare crisis versus employment economic crisis. They're leaning more towards, hey, let's protect against the economic crisis because this is a marathon, not a sprint, and we'll sort of see how this plays out. So they have had to play a little bit of catch up. They are starting to impose harsher restrictions on movement and shelter in place and quarantines.
Clearly, the availability of accurate testing is clearly a difference maker in controlling the path or the curve, if you will, of the virus. So maybe summarize all the things we've learned from these countries.
Yeah, the biggest thing you sort of can't manage what you can't measure is what we always say. And if you're in the U.S., if you're a governor, and you're going to make an informed decision as to whether or not you're going to reopen or not, it's difficult to do that if you don't understand the overall magnitude of the health situation and you don't have the testing available to you. And so getting testing available is extremely important. And you can see the folks that were at an advantage, the different countries that were at an advantage in terms of testing, they haven't really had a bad health outcome or an economic outcome, because they have the availability of that information. And then also, trust in government has been very important. To think that New Zealand's approach would ever work in the U.S. It just wouldn't happen. It
Right.
would absolutely never happen. So trust in government and dealing with smaller populations, all that is a very important takeaway as well. And then understanding some of the health conclusions that have been drawn by some of these countries. South Korea, for example, recently came out with a report that they no longer feel it's necessary to retest confirmed cases after they've recovered. So answering one of the big questions, can you get it twice? And they've determined through all their testing that, for a period of time, an uncertain period of time, no, you cannot get the virus twice. And that's very important as we think about reopening and we think about the probability of a second wave in 2020. That's in the US, and that's a very valid source. And then also looking at Iceland, and you can see if testing was available broadly, maybe the mortality rate of this virus would be less than 1%. Tough to say exactly what it would be, but it would be far lower than what's being reported. And that has a psychological effect on folks. So that's also very valuable information.
Perhaps let the viewers know how we use this information and what we do with it in terms of formulating our investment strategies and our investment decisions.
Yeah, there's a lot of uncertainty right now about how reopening will go and the probability of a second wave. And to be able to look at these other countries and see how they're dealing with it, and seeing that even if there is a second wave, contact tracing and testing can basically allow you, if you follow that, so South Korea's program, for example, can allow you to manage that with little to no economic consequences. that's extremely bullish.
Mm-hmm.
Because then you don't have to make a call on whether or not there will or won't be a second wave. That's very difficult to do, but at least you can see there is an approach that will allow you to manage a potential second wave without suffering economic consequences. And that, when you think about that relative to earnings estimates for 2021, it can allow you to have a very bullish view on equities and about how to invest.